Cardiovascular disease in simple terms can be defined as diseases related to the heart or blood vessels. The cardiovascular system of the body is responsible for the transportation of blood throughout the body. The cardiovascular system is also known as the circulatory system. The main elements of cardiovascular system are the heart, veins, arteries, and blood capillaries. If any of the elements of the cardiovascular system is not able to perform its function properly, the cardiovascular disease occurs. The failure of the cardiovascular system can result in instant death. The most common types of cardiovascular disease. Coronary artery disease. Coronary artery disease is an artery disease occurs when arteries that supply blood become narrow due to the buildup of plaque. This buildup of plaque is known as the atherosclerosis. High blood pressure. High blood pressure is also known as hypertension is a condition in which the impact of the blood against the artery wall is too high. Cardiac arrest. A cardiac arrest is the condition when the heart suddenly stops to function. When the heart stops beating, the transportation of oxygen rich blood is stopped, resulting in unconsciousness. The most common types of cardiovascular disease. Stroke. A stroke happens when the supply of the blood to the brain is interrupted, due to which cells in the brain start to die immediately. Causes of cardiovascular disease. The most common behind the cardiovascular disease is the development of plaque in the arteries and blood vessels that lead to the heart. Other common factors related to cardiovascular disease are smoking, uncontrolled diabetes, obesity, depression, unhealthy lifestyle, physical inactivity, high level of cholesterol, genetic, excessive drinking. Symptoms. If these symptoms are ignored and not treated in their earlier stage, they may result in serious complications in the future. Some major symptoms of cardiovascular disease fatigue, irregular heartbeat, short, shortness of breath, chest pain, nausea, lightheadedness, heartburn, indigestion, lack of appetite. Diagnosis of cardiovascular disease. The diagnosis of the cardiovascular disease depends upon the patient's heart condition. Besides a physical examination asking about your medical history, a cardiologist is likely to perform some diagnostic tests. Electrocardiogram ECG. ECG records the electrical activity of the heart. It detects the abnormal pattern of your heartbeat. It checks if all the heart valves are working properly or not. Magnetic source imaging of heart. A cardiac MRI creates the still and moving picture of the heart and other major vessels. Diagnosis of cardiovascular disease. Computerized tomography CT scan. A CT scan of heart is an imaging method that creates a detailed picture of heart and its blood vessels. CT scan uses X-rays to create pictures of circulatory system. Blood test. The blood test is done to check the level of cholesterol, fatigue, sugar, protein in your blood. Increase in the amount of any unhealthy element in your blood increases the risk of heart disease. Treatments. The best way to prevent the risk of cardiovascular disease is to adopt a healthy lifestyle. However, if a person is already diagnosed with a cardiovascular disease, a combination of medicine and surgery is used to bring back their life on track. Medicines, calcium channel blockers, blood cholesterol lowering agents, nitrates, antiplatelet, beta blockers, surgeries, coronary artery bypass grafting, stent procedure, heart valve repair or replacement, heart transplant. This is a brief video. If you like, please subscribe my channel and share this video.